What did I miss, Greg Flynn? Did I get all of them?
I know it sounds like a hands, shoulders, knees, and toes song you got going on there, Dave.
He is the chief of the West Bloomfield Fire Department and joining us from Fire Station number 5, it looks like to me. Thank you for joining us today, Chief. How's everything going with our first responders in Oakland County today?
Well, good afternoon. Well, almost afternoon. It's good to be with you again, Dave. It's such a great work that your team's doing with the MegaCast, and it's always a pleasure to be part of that. As you can see over my shoulder, we're starting to find ways of getting back to our routine here at the fire department. You're going to hear some bottles clang. We got some knot training, rope training that's going on behind me here, but things are returning back to some standard levels as far as call volumes go. I think folks are feeling more comfortable dealing with the things. You see, I'm wearing my mask today, and you may see some of the firefighters walk behind me wearing masks. We're getting more comfortable with doing that as part of our everyday inner workings with one another, especially when we're not able to observe the 6-foot social distancing.
Well, I appreciate that, and that's essential. And now businesses are beginning to open in our area, manufacturing beginning to open this week, and we'll have more of that. And different sectors of the economy are opening, so people are getting out of their homes more, and so it's really important that these things that you should have been doing anyway, but as you start to get out and in a more exposed environment, that you're doing all the things that we just talked about and implementing that. I talked to help me out here, and we didn't talk before we went on the air, but I talked to Dave Coulter, our county executive, a couple of days ago on the show, and he mentioned briefly a program that some of the fire departments in Oakland County, and yours in particular, are helping the county with. I think it had to do with transporting some patients maybe at nursing homes. Are you familiar with what he was talking about?
Well, what I think the county executive might have been referring to is the need that the state emergency operations center identified, that our long-term care facilities, our senior apartment complexes, were target areas that we saw that the coronavirus was spreading rapidly. So what we wanted to do was get in there and mitigate that with testing. The struggle the county was having was, as the state was allocating tests, what the county needed was staff to administer those tests. So we partnered, I think ourselves, our colleagues down in Southfield, I think Birmingham, our friends in Farmington Hills, the medics, small group of paramedics at each group took specialized training. And then we went into facilities that we're familiar with. We're in and out of these facilities every day, Dave. And so we're familiar with the staff, we're familiar with the residents, the floor plan. And we went in with the county health, and we were able to test hundreds of residents. And I believe we have another one scheduled even for later on this week to go in and do hundreds more tests right here in West Bloomfield.
And that's a beautiful story, Greg Flynn, the chief of the West Bloomfield Township and Tri-City Fire Department. So thank you for clarifying what the county executive was talking about. We had a really brief conversation about that, and I didn't completely understand. But, that's a great example. There was a need, there was a fit, and you were able to help out with your part. County helped out with their part. You guys all worked together. And I know those kind of communications are going on every day. I imagine you're still having all those conference calls with fire departments and other agencies that you're interacting with on a daily basis to figure out how to solve problems just like that one.
We have, and those, while we've refined those down to some strategic times throughout the week, everybody is starting to find the efficiencies that we have to get the job done. And so some of those calls aren't as necessary as they were weeks ago. I think our math shows week 9. And so we're 9 weeks. I would hope that we could start to master some of this. And I think we have, we've done really the staff, I say I put myself in there, but really it's not me. It's the folks that you see walking behind me in the shot here every so often. they truly are on the front line, and they're the ones that make it happen.
Well, there has been tremendous progress, and certainly we should take time to note that. And yeah, it's been 9 weeks since we started this show, and really this this pandemic began to rear its ugly head here in Oakland County and in West Bloomfield. Today, though, we wake up and read the news, and my notes say 16 new cases in Oakland County, and I mean that we still have the coronavirus here, but that is a great sign that the folks in the county are doing everything that they can to mitigate the spread. Your thoughts, Greg Flynn?
Well, my thoughts are that here we are 9 weeks into something that we've really never had to deal with before, and we're already seeing those numbers come down. So again, I'm not throwing a victory flag out there yet. What I'm recognizing, and I think we need to acknowledge, is the swift action that our state and local governments, our county government, what they've done. And the people, from the folks working at in the labs to the folks that are putting engineering controls in our grocery stores and the one-way aisles and dedicated shopping time for at-risk populations. Everybody contributed to this. We sometimes focus a little bit selfishly here on that public safety response from police and fire, but there are so many people that have stepped into solutions on the side of fighting this pandemic that again, you hear me that theme of celebrating that, and I think we need to, and you highlight that so often with this lineup of guests that you bring on that are addressing all of these different ways of looking at the pandemic, the different lenses we look through. And clearly my lens is more of an emergency preparedness thing, but you get the educational component with the school district, and you're getting the mental health component with counselors that you have on the show. It really is a comprehensive look at the pandemic.
Well, that's kind of you to say, and we've been seeing finally some media outlets starting to pop up that are there specifically to provide positive news, and we're just trying to tell the story from the front line. But as we start to tell the story and talk to people, there is a tremendous amount of positive news. And yes, we have barber shops in Owasso and protests in Lansing that are making news and captivating most of what you see at 6 and 11. But the reality of what you just said, Greg Flynn, is apparent, and you have to be totally blind and deaf not to see the amazing progress that we have made. And it hasn't been easy. And let's be honest, COVID-19, it's still there. It's still ugly. The disease hasn't changed. Okay, we've changed our behaviors, and all those people have done an amazing thing. And I really enjoy talking to you because we were there right at the very beginning, and you've really helped us identify and get through these things. So big focus now, and we can pat ourselves on the back. That's good. But the big focus now is getting businesses open. And we talked to a restaurateur earlier in the show. They're not open yet. That's really hurting their business. They can't open. There are other sectors of the economy that aren't open. So as manufacturing opens, which I know isn't a big factor in your service area, but as other areas of business begin to open up, it's important that we do all the right things so we don't see a spike in any way whatsoever, and we can keep opening up this economy. It's again, I just want to remind everybody of that, and I'd just like to hear your thoughts on that again, and anything you want to share in that area.
So if you were to go back and play some of our initial or that first interview, and I think it was in the first interview or the second time that we were on this coronavirus special update, right? I was trying to underscore the need that knowledge is power, right? And that a well-informed community is a resilient community and a community that is ready to respond. That's what we've accomplished with the different venues. You have Deputy Chief Lawson on, our public information officer, sharing the messages that are coming out of the Emergency Operations Center. Again, the list of guests that you have on the show. What I'm getting at, though, Dave, is all of that is specifically tailored to informing the public. I was listening to the national news this morning at breakfast, and one of the commentators said, people aren't safe. And I need to know, what is it that people need to know so that they can be safe? And it's almost like we're dictating that they're not safe. We're saying you're not safe. And what this has done, what our conversations have said is, here's how to be safe. Here's how you can be knowledgeable. And 9 weeks in, now I don't want to, I'm not superstitious, but 9 weeks in, working in the Emergency Operations Center, working around people taking care of sick patients, a workforce that is in treating patients in their homes sick, positive for COVID-19, and our count remains at 3. All 3 of those individuals that got sick at the WBFD were all tip of the spear, all early in March. Workers need to know you can do it. You can do it, but we have to get over this stigma right here that this is okay and I can have a conversation with you. We have to understand that 20 seconds is 20 seconds of aggressive hand washing, and we need to know that we don't want you doing this. So, and that it's okay when I meet somebody new that I say, hello, yeah, good to meet you. And I don't need to go out with a handshake. Those things are easy to overcome with that knowledge. And that's what we're doing. And so we celebrate that success. And as I know, the team at Town Hall is going to be bringing back our staff there. And the message to them needs to be, it is safe. And you control that part of your safety. And we're responsible to one another. I'll tell you, the message we want to leave with today, though, is this one here, Dave. Not acceptable. I think we need to diagnose this as like FCMP, facial covering misplacement. Okay, this isn't.
Hold on, wait,
anybody.
hang on, hold on. We have to add that to the COVID-19 vocabulary, Tyler. One more time. What was that? Facial covering displacement.
Or misplacement, yeah. However we want to acronym that, you know. I like
facial covering misplacement. FCM. I'm just making sure that anything that starts with an F, you've got to be very careful over the rest of the acronym. Okay, so facial covering misplacement. I like it, Greg. Hey, listen, we got to go. Thank you very much. We'll do this again. Excellent advice.
Sounds good.
Perfect story. Thank you so much for sharing that story that your department, 3 people got sick in your department, and you are absolutely the tip of the sword, and it happened in the very beginning of it. We can do it. One final question. Are we keeping an eye on things? Because as we open things up, we certainly don't want it to go the wrong way. Can you just assure us that somebody somewhere, the county, the township, the state, the federal government, or all of you guys are keeping an eye on things every day to make sure that if we run into another problem, that we're able to address it as quickly as possible?
The answer to that is a firm yes. We're well aware of what can happen with a rebound or another outbreak of this. But just please keep in mind, we can provide the path. We can provide the resources, but it's the responsibility of each individual within our community to embrace that and to take the self-responsibility that it is within a community to stop the spread of COVID-19.